It's kind of an interesting exercise I'm doing here. It's probably unlike what you've seen before. Small movement, but gets a lot done. It's an adductor exercise. So we call this the NT loop, half kneeling, hip adductor foot shuffle. Now I have to give credit where it's due. I learned this exercise from Dr. Eric Serrano, who's a big fan of the NT loops. So what I'm doing here, first off, your adductors are an often neglected area for athletes to work on. They tend to work on their hip abductors, which are those what some people call upper glutes, but they often neglect their adductors. And there is some research out there, more than one paper, that shows one of the increased risk factors, or one of the risk factors that is weakness of your adductors for a groin strain or adductor strain. So having strength can help reduce that risk factor. Now, this is an exercise for it. So how am I doing it? Well, we've got the NT loop anchored around your knee height. You may notice I have just the utility strap there and hooked to the anchor strap and the carabiner. If you don't have one of those utility straps, because that's something you just get from a climbing store, no problem. Just use a single wrap or anchor the NT loop against a cable or inside a door, just at the appropriate height, and you're ready to go. It's above my knee. I want to stay tall. It's on the same side leg as it's anchored on, so it's anchored on my right, therefore it's my right leg that's working. Just above my knee. I want to stay tall here. I don't want to flex. Stay tall, and then all I do is I just shuffle my foot, just like that, as far as I can until I can't go anymore, and then I come back, covering about that much distance. How much distance? It's about 6 inches maybe, 6 to 10 inches. How far out do you go? Well, it depends on your strength level. You want to get the appropriate tension to where I'm here, I still have some tension, and then when I'm here, I have as much tension as I can tolerate, and then I go back. So we tend to do this more for time, 30 seconds to a minute per side. When you're done with it, just take the tension off like that. See what I did there? Come off. Just let it fall. I would turn around, bring it up to the other knee. Here. Kneel down first, and then adjust accordingly, and then I'm off and running. What's important is that when you do the exercise, the band is directly out from your knee. It's not going back that way. It's not going that way. It's directly out from your knee. So you have direct tension as you shuffle your foot.